Hello guys, this is Dr. C here, day number 10 of the Done is Perfect Challenge, the lumbar number 5. We are talking about the sacrum. Yes, we were talking about the sacrum yesterday, how this is affected and what is the best approach to be least invasive with that bone if it's something going on there, okay? So today we have this is the lumbar number 5, okay? That's the lumbar that connects directly with the sacrum, okay? This bone is called by Dr. Clarence Gonstead the bone most important in the spinal column, okay? This is Dr. Gonstead, okay? And this is his clinic. He made this clinic in Wisconsin in the shape of the sacrum, okay? And the one in the back, that is a hotel in which people from all over the country are even all over the world. They travel, and they even have an airport right behind them to get the planes for all over the country and all over the world, attending people down there. This is the clinic inside. So you can find more in Google with Clarence Gonstead Clinic. So that's amazing. So, and you can check the results with this approach, okay? So today, talking about the lumbar number 5 and having that statement from Dr. Gonstead, so we can identify why is that important. And this is super important because this one, the nerves right here, control. You remember we talked about the parasympathetic and sympathetic nervous system? That is like a car having a gas pedal and the brake pedal. So these particular nerves have both controls, sympathetic and parasympathetic controls. And let's talk about the details in the 3 systems that we talked before: the sensory, the motor, and also the autonomic, which for me is the most important, okay? So sensory wise, when we have issues in the lumbar number 5 with the nerves in the lumbar number 5, we can have sensations around the belt. That's gonna be a sensation around that area, around. Could be also local, right here, localized pain. Patient is also gonna present with troubles trying to lift from a chair, from a seated position. Doing this is gonna be restricted. It's gonna be painful as well. They're gonna be locked. They're gonna be unable to do that, okay? Also, they can present with hip issues, and that's related to lumbar number 3 down to lumbar number 5. So also they can have a lateral ankle issues, sensations, altered sensations, or medial foot pain or altered sensations as well. In the motor portion, when we are talking about the motor portion, we have restriction in leg extension, and also we're gonna have problems trying to lift the toes up, okay? So if you look at your fingers and your toes and you try to lift those up, that's gonna be weak, that type of motion as well, if we have motor issues with the lumbar number 5. If we have autonomic issues, like I said, this is the most important for me. Let's talk about the blood pressure. Blood pressure is controlled by one of the main controls is gonna be the lumbar number 5, the nerves. We have 2 types of pressure, systolic and diastolic. Diastolic one is the more dangerous. That can cause a stroke. So we need to make sure we approach one type of blood pressure at a time, and we need to make sure that is holding for at least 1 month. After a month, we need to approach the other blood pressure, which is the other nervous system. One is controlled by the sympathetic nervous system, the other one is controlled by the parasympathetic nervous system. So it's crucial to have the right approach in order to correct this type of issues if you have blood pressure. There is other bones as well in the upper cervical area. We're gonna go up now, okay? We just started yesterday from the sacrum. We're in the lumbar number 5, which is another spot for blood pressure. As well, if we have slow bowel movements, that could be related as well to the lumbar number 5, okay? Or the other extreme, because we are talking about sympathetic and parasympathetic. The other extreme is gonna be diarrhea, Okay, so if you have the nerves, the sympathetic nerves in that bone affected, you're gonna present with diarrhea, inexplicable. Okay, so you need to make sure that bone is right, set in the right way, in the right position, not affecting any type of nerve control. Okay, as well, the liver. The liver is related to the lumbar number 5 and the thoracic number 9 as well. Okay, so it's crucial to make sure we have this properly functioning, even if you are taking medication. If you are taking medication, you need to make sure you have these bones right in the right alignment, that the nerves are not affecting the liver function in this area. All of this is kind of, in conclusion, this is all mechanical. So we don't need to resolve or find solutions with something chemical when there is something mechanical. So we need to make sure the structure, the bones are not affecting how the nerve impulses are coming in and out from the spinal cord, and then in that way we kind of start doing another type of approaches, making sure that the nervous system is working properly. Okay, chiropractic in that point is the best thing, is the best type of healthcare approach to solve a mechanical problems in your body. Okay, so the same Dr. Gonstead state that the line of correction for this bone is specific. We need to find the specifics even with the x-rays to make sure we are correcting that one in the specific line of correction, to make sure we are fixing the issue. Okay, so chiropractic is the best approach to make sure your body is aligned and your nervous system is working properly, even having the right line of correction for you. Okay, so that's all, guys, for you today. If you have any questions or suggestions, just let us know. eolcairo@gmail.com, or also you can subscribe to the channel. We are in Facebook as Expressions of Life Chiropractic Clinic, Chiropractic Center. We also have Instagram and Twitter. We are EOL Cairo. Okay, so thank you so much, guys, and that's all for today. Have a great day. Bye bye.